as you very well know, that Peshawar was flooded with drug addicts, and the situation was ignominious and derogatory. And there was a realization on the part of the provincial government also that we need to do away with this menace. So it was also giving a very ugly look to the city of Peshawar. Besides, the human element was also involved in it. So a well thought out plan was made, a strategy was made in which all the segments of the society were covered, all the problems related to this were covered. So I involved the private sector also, because it was not possible without involving the private sector into. So currently it is a kind of a public-private model. Then I had 5 long sessions with all the stakeholders that included people from the NGOs, that included people from the government side, and we prepared a well thought out strategy. That strategy was then presented before the Chief Secretary and the Honorable Chief Minister Mahmood Khan, who gave approval to this, and he liked the idea, and then he said that if it gets successful in Peshawar, then we'll be extending this to the whole of the province. So currently we have undertaken that strategy, we have undertaken the implementation of that strategy, and you will be glad to know that we have picked around 1,300 drug addicts from the cities and roads of Peshawar, and we have started the process of rehabilitation. And I really feel very much glad and satisfied when I look at them, when I saw the condition initially when we were picking them up, and now when I see them in these rehabilitation centers, the way they are behaving, the kind of treatment that is being given to them, and the kind of environment that exists in these centers, and the response that we are getting from the drug addicts, the response that we are getting from the people of Peshawar, and especially from the families of these addicts, that gives a lot of satisfaction to the government, that gives a lot of satisfaction to all the people who are involved in this process of rehabilitation. Like I said, that we involved all the stakeholders. That included the Nai Zindagi NGO, and then according to the strategy, when we pick the drug addicts, they are sent to the rehabilitation centers, and then we detoxify for 15 days, and then they are supposed to be with us for the next 3 months. And each drug addict, we pay rupees 30,000, the provincial government pay rupees 30,000 for each of these drug addicts, and then out of more than 1,200 drug addicts, after testing them, we have identified 44 HIV positive. So now we are seeking support from the Nai Zindagi NGO, and we have put them in separate compartments and separate centers just to separate them from the other drug addicts. In addition to this, there are other there are addicts which are carrying other diseases. So we are dealing them accordingly. We have the psychiatrists, we have the doctors. Like initially when we were selecting these centers, so we chalked out a proper strategy for the selections of these centers. Like for example, there was a committee who was looking after this. The committee worked on it. They prioritized all these centers. They saw the capacity in terms of medicines, in terms of the doctors, in terms of the psychiatrists, and in terms of hygiene. So the current, the kind of rehabilitation that is taking place, as I earlier said, I think I've never seen it before, and I'm very much satisfied with it, and my teams keep on visiting it. And I must tell you one thing very important, that as I said, that I've involved all the public and the private sector both. I think that the leading role that is being played is by the Excise and Taxation Department, the Social Welfare Department, the police, and of course the district administration. And then we have also established a control room in the office of the Deputy Commissioner, and the Deputy Commissioner directly oversees the functioning of that control room. There we synchronize and scrutinize the whole data. For example, One important element that is a part of our strategy is the contact and tracing of the families of the drug addicts. So we have developed a data mechanism of each and every drug addict that includes his or her family, and then we are now in touch with the families, and once these drug addicts get rehabilitated, we would like to make them responsible citizens of our society. They will be back in their families, and our city will be free of this menace. Like I said, that we have developed a well thought out strategy. So the first one is to pick them and take them for rehabilitation. Then the last part of the strategy is to equip them with technical expertise. So currently we are in the process of detoxifying them, and we are also in the process of picking the leftovers. Very few drug addicts are left now in Peshawar, so we are also going in the streets and bazaars of Peshawar to locate them initially and then take them to these centers. So that we will be inshallah equipping them with technical expertise, and then we have already talked with the industrial associations, we have talked with the Chamber of Commerce, and we have talked with our sports and culture department, and we should be able to generate at least 1,000 jobs for them. So once when we feel that they have been properly rehabilitated, they have got that required and necessary expertise, we are already in the process of creating the job opportunities for them. There are about 21 females who were drug addicts, and we have picked them, and they are rehabilitation centers, and we have kept them totally in a different center, and proper care is being taken of them. We have also children with us, so the children are both the children and the women, they are kept in those foundation, and there is a separate center, separate training and separate treatment mechanism for them in those centers. We have a definite plan to equip them with the skills, and the women will not be an exception. Of course, we will be focusing more on them. Initially, like the priority will be to take them back to their families, and we will also be, of course, in case if we come across a problem in this regard, we will be providing them jobs, and that too on priority basis. The future plan of this program is that we want to have an end to the drugs flow, and we want to have an end to the existence of the drug addicts in our society. We have been discussing this. We have taken off very well. It is being appreciated a lot in the general public. We are getting a lot of positive response from the public. We are also in the process of coordinating, motivating our communities, because without the help of the communities, I don't see any success. So one aim of our plan is to coordinate, to empower the communities, to create awareness, and to seek help from these communities in this regard. And one important element, of course, we have discussed this with our higher-ups. Next week we are going to have a meeting under the chairmanship of the Chief Minister Sahab, and the most important aspect is the preventive side. We want, and in that regard, we will be seeking the help of the Excise and Taxation Department, the Police Department, and the ANF. So that meeting is going to be held next week under the chairmanship of Chief Minister Sahab, and I'm sure that stringent, hard measures will be taken to curtail, to stop the flow and smuggle of drugs into Pakistan from Afghanistan. First of all, I would like to thank the INL, because they have been working since very long. Initially, I've also worked with them when I was a young officer in eradication of poppy in the tribal areas. So I really appreciate their role, and I also would like to thank them for their role that they have played in eradicating this menace, in eradicating poppy and drugs. I would also like to thank them as a secretary. When I was Secretary Excise and Taxation, they gave us a donation of $1 million, and that was effectively used in enhancing the capacity of the department. And currently, with this plan, with the strategy that is being implemented by all of us, I would request them to come forward and help us in giving us technical expertise and also help us in the sectors where we need financial aid.
Thank you very much.
Thank you very much.